Welcome to Pennsylvania in Focus. I'm Kristen Smith. Healthcare deserts are growing larger in the state. The problems can range from workforce shortages, consolidations, and higher costs for urban and rural Pennsylvania alike. Joining me today is the Center Square's Pennsylvania reporter, Anthony Hennon. Anthony, healthcare deserts, we've reported a lot about this in the past, but what do you think, in order of importance, are the biggest issues that are making these areas grow larger and larger in Pennsylvania?
Yeah, so it seems like two that really stand out here is simply workforce shortages, but also reimbursement rates. So when you're looking at rural healthcare, this has been a long-running problem. It's been something that was a problem even before the pandemic hit, but it really became a bigger issue afterward. We're looking at 33 hospital closures have happened in the past 20 years. 15 of those happened in the past 5 years. So this is kind of a trend that's been accelerated by these other pressures. A lot of rural hospitals are having difficulty recruiting a workforce to come in and work. And since a lot of these rural areas, you have the lower volume of patients, that means they're more reliant on Medicaid reimbursements. You have higher fixed costs. And also, not only do you have these higher fixed costs, but the types of patients coming into these rural areas, they're generally older, they have more acute issues, and Medicaid is a bigger part of the financial mix here, as opposed to private insurance or Medicare payments that we'll see in a lot of suburban or urban areas. So not only are you having fewer patients, but they're also a bigger financial strain. And then when you look statewide, Pennsylvania's population, the only parts where it's really growing is around cities or in the suburbs. So you're having an even bigger crunch on finding anyone to come in and offer services. So we're seeing, more local hospital closures or hospitals closing obstetric services. We're seeing more standalone emergency rooms. And this is basically creating a situation where you have fewer options for healthcare access, and that's also working against people considering maybe I should live here, but if you have to travel 30 or 45 minutes to the nearest hospital or health center, that also discourages them and makes this problem worse.
So you wrote in your article that a big part of the access challenge as well is the lack of doctors and nurses, and it seems like, according to reporting, that there's not exactly a huge shortfall. It's just difficult to get permission to work in the state.
It's a bit of both. When this was happening earlier this week, a Senate Democratic Policy Committee hearing featured Tammy Torres, who is the president of the Lehigh Valley Hospital in Hazleton. And she was arguing, when I'm looking at the data, in the next 6 years, the Commonwealth will need 1,000 primary care physicians. With a shortfall of registered nurses, we're looking at over 20,000. Mental health professionals, 6,000. Support staff, the biggest thing, it's about 280,000 individuals we'll need over the next several years. So one is, a lack of medical professionals, but also, when she's looking at bringing over doctors and nurses from Puerto Rico, they have trouble going through the licensing process because of requirements that they take in English as a foreign language test, even though they're already bilingual. So we've seen a number of nearby states like New York and Virginia who don't require tests like that, but Pennsylvania does. So it seems like we have a mix of, it's hard to recruit these workers, but it's also hard to get them through Pennsylvania's permitting and licensing process.
Pennsylvania also has a lot of mergers and acquisitions in the healthcare space. So what impact does this have on the healthcare deserts?
Yeah, so Patrick Keenan, who's Director of Policy and Partnerships for the Pennsylvania Health Access Network, he argued that a merger, acquisition, or change in ownership is one of the best predictors that a community will experience a full or partial closure. The moment to start looking at closures is when a merger or acquisition happens. And I think that's a general sign here. It's not necessarily a situation where, because someone is taking over a hospital or combining a hospital, it means they're aiming to close it down. I think it's just a sign of these things are happening because hospitals have tried a lot of different things, and the only thing left to keep them viable for at least a little longer are mergers or acquisitions. So, this is a problem of finances. This is a problem of workforce. And it's also reflective of, Pennsylvania's broader issue of population changes and population changes that are happening as the Commonwealth is aging too, which requires more care, more healthcare services, and a way to fund it. Pennsylvania, like a lot of other states, simply has not figured out a solution or found the answers for this.
Anthony, thanks for joining us today. Listeners can keep up with this story and more at thecentersquare.com.
He ran for state office and was beaten. Started a business and failed. Ran for Congress and lost. But thankfully, Abraham Lincoln didn't give up. Persistence. Pass it on. From the Foundation for a Better Life at values.com.